It's normal to feel anxious from time to time, especially if your life is stressful. However, excessive, ongoing anxiety and worry that interfere with day-to-day activities may be a sign of generalized anxiety disorder. It's possible to develop generalized anxiety disorder as a child or an adult. Generalized anxiety disorder has symptoms that are similar to panic disorder, obsessive-compulsive disorder, and other types of anxiety, but they're all different conditions. Living with generalized anxiety disorder can be a long-term challenge. In many cases, it occurs along with other anxiety or mood disorders. In most cases, generalized anxiety disorder improves with medications or talk therapy, also called psychotherapy. Making lifestyle changes, learning coping skills and using relaxation techniques also can help. Symptoms. Generalized anxiety disorder symptoms can vary. They may include persistent worrying or obsession about small or large concerns, that's out of proportion to the impact of the event, inability to set aside or let go of a worry, inability to relax, restlessness, and feeling keyed up or on edge, difficulty concentrating, or the feeling that your mind goes blank, worrying about excessively worrying, distress about making decisions for fear of making the wrong decision, carrying every option in a situation all the way out to its possible negative conclusion, difficulty handling uncertainty or indecisiveness. Physical signs and symptoms may include fatigue, irritability, muscle tension or muscle aches, trembling, feeling twitchy, being easily startled, trouble sleeping, sweating, nausea, diarrhea or irritable bowel syndrome, headaches. There may be times when your worries don't completely consume you, but you still feel anxious even when there's no apparent reason. For example, you may feel intense worry about your safety or that of your loved ones, or you may have a general sense that something bad is about to happen. Your anxiety, worry or physical symptoms cause you significant distress in social, work or other areas of your life. Worries can shift from one concern to another and may change with time and age. Causes. As with many mental health conditions, the exact cause of generalized anxiety disorder isn't fully understood, but it may include genetics as well as other risk factors. Risk factors. These factors may increase the risk of developing generalized anxiety disorder. Personality. A person whose temperament is timid or negative or who avoids anything dangerous may be more prone to generalized anxiety disorder than others are. Genetics. Generalized anxiety disorder may run in families. Being female, women are diagnosed with generalized anxiety disorder somewhat more often than men are. Treatments and drugs. The two main treatments for generalized anxiety disorder are psychotherapy and medications. You may benefit most from a combination of the two. It may take some trial and error to discover which treatments work best for you. Psychotherapy, also known as talk therapy or psychological counseling. Psychotherapy involves working with a therapist to reduce your anxiety symptoms. It can be an effective treatment for generalized anxiety disorder. Cognitive behavioral therapy is one of the most effective forms of psychotherapy for generalized anxiety disorder. Generally a short-term treatment, cognitive behavioral therapy focuses on teaching you specific skills to gradually return to the activities you've avoided because of anxiety. Through this process, your symptoms improve as you build on your initial success. Lifestyle and home remedies. There's no way to predict for certain what will cause someone to develop generalized anxiety disorder, but you can take steps to reduce the impact of symptoms if you experience anxiety. Get help early. Anxiety, like many other mental health conditions, can be harder to treat if you wait. Keep a journal. Keeping track of your personal life can help you and your mental health provider identify what's causing you stress and what seems to help you feel better. Prioritize issues in your life. You can reduce anxiety by carefully managing your time and energy. Avoid unhealthy substance use. Alcohol and drug use and even caffeine or nicotine use can cause or worsen anxiety. If you're addicted to any of these substances, quitting can make you anxious. If you can't quit on your own, see your doctor or find a treatment program or support group to help you. Stick to your treatment plan. Take medications as directed. Keep therapy appointments. Consistency can make a big difference, especially when it comes to taking your medication. Join an anxiety support group. Here, you can find compassion, understanding and shared experiences. You may find support groups in your community or on the internet. Take action. Work with your mental health provider to figure out what's making you anxious and address it. Let it go. Don't dwell on past concerns. Change what you can and let the rest take its course. Break the cycle. When you feel anxious, take a brisk walk or delve into a hobby to refocus your mind away from your worries. Socialize. Don't let worries isolate you from loved ones or enjoyable activities. Social interaction and caring relationships can lessen your worries. Be healthy and happy.